that the trachea and the main bronchus are visible here. Each bronchus in this picture, we are going to explain for you that these green lines are going to remember you the pleura. Do you know what's the pleura? It is such as the pericard. Only the or pleura consists of one layer, but the pericard consists of two layers. It's called fibrocerose, but about the or pleura, covering sheet of the line, we explain only one layer. Okay? So which of them is thinner? Pleura or pericard?
Pericard.
Pleura. Now, look at the picture. Each bronchus during the development are going to invaginate inside of the pleb or pleura. So at the end, this pleb is going to cover each line separately, and here laterally means each line is going to cover by the visceral layer of the pleura and parietal layer. The visceral layer adherence at the external layer of the line, and the parietal layer is upper layer. Between the parietal and visceral, here you are able to find a space. This space we call pleural cavity. Inside of the pleural cavity, you have a small amount of the liquid, a small amount of the serous epithelium secretion. This small amount is going to remember you when you are going to use the cream or when you are going to use the oil for your hand. After you using the cream or oil, your hand, the skin become wet. But are you able to explain for us how much liquid is on your hand? No. About here is the same. Between the visceral layer and parietal layer, inside of the pleural cavity, you can find a small amount of the liquid. But this small amount only is going to decrease the friction during the inspiration and expression. Normally, inside of this pleural cavity, you are not able to find any air. But in pathological time, you are going to find some air. As you know, the air is light, so go up. Yes? If the extra flows, such as the blood, such as the pus, come inside of the pleural cavity, according to the gravity, it is coming down. Now, if we look at this picture, in each side of the thorax cavity, we have a space. Inside of this space, in each of them, we can find one lungs. This lungs in each side is going to cover by the pleura. And this pleura consists of two layers. One of them is visceral layer, adherence to the line, and you are not able to separate. And one layer we call the parietal pleura. This parietal pleura is going to be related and near the wall of the thorax.
The external layer innervated by phrenic.
For the innervation, I'm going to speak later, okay? Only you know that here we have the lungs, and each lungs consists of some surface. Here is the apex of the lung. Here is the base of the lung. Because this space of the lung is near the diaphragm, you can call the diaphragmatic surface. Here is the costal or lateral surface, and here is medial or mediastinal surface. What's the name of this space between two lungs? We have a quadrangular space that we call mediastinal. So each lung consists of medial surface or mediastinal surface. external or lateral surface that we can call coastal space, and inferior surface or
Diaphragm.
base or diaphragmatic surface. Each line consists of the apex, lateral surface, medial surface, inferior or diaphragmatic surface. Okay?
Okay.
In which surface you are able to find the hilum?
Medial.
Hilum. Medial
Medial
surface.
side.
What's the another name of medial surface?
Quad-
Mediastinal surface, because it is going to look at to the mediastinal. So in this picture, you are going to look at to medial or mediastinal surface, lateral or coastal surface, inferior or diaphragmatic or base of the line. In medial surface, here we have hilum. As you know, hilum is an area, a place that some of the structure are going in and some of the structure are leaving the lungs. Okay? Can you imagine?
Yes.
Now, in this picture, you are going to look at to the mediastinal or medial surface of the line, right and the left line. This right line is small, but the left line grow completely, develop completely. The visceral pleura is exactly adherence to the line, and the parietal pleura will be found here. Okay? This parietal pleura, when it is going to cover the medial surface, we call mediastinal pleura. When it is going to cover the diaphragmatic surface, we can call diaphragmatic pleura. And when it is going to cover the lateral surface, we can call coastal form. And here, this yellow color is going to remember you a small area of the parietal pleura that it is going to cover the apex, the cupula of the lung. Do you get that?
Yeah.
Do you have any question?
No.
Now, in this picture, it is going to remember you that what happened, that the cleft is going to form from two layers. Imagine, here is your hand is going inside of this sac, so this layer is going to form for you the visceral layer, and this layer is going to form for you the parietal layer. The space between the visceral and parietal is going at the end form for you the pleural cavity. Okay?
Okay.
Can you imagine?
Yeah.
Your hand is going to invaginate to this purple color. For example, to this purple structure, purple nihilus. This layer of the nihilus, exactly near your hand, is going to form the visceral pleura, and here, around the umbilicus, along the hilum, it is going to reflect it to parietal pleura. Now, again, it is going to show you how invaginate inside the flare, and it is going to form for us the pleural cavity. The trachea is visible here. The trachea is going to be begin inferior to the larynx. Inferior to the larynx, the trachea is going to be big. Stop. Here you have the trachea. Trachea is coming down and here divide to two branches. The main bronchus in right side, the main bronchus in the left side. In this picture, you are going to look at to the trachea. Trachea is coming down, and when the trachea is coming down, it is coming and passing through the neck, very soon passing through the superior mediastinum, and in superior mediastinum, inferior to superior mediastinum, inferior to arc of the aorta, the trachea is going to divide to two terminal branches. The two terminal branches of the trachea we call the right and left main bronchus. Which structure is visible anterior to the trachea and left side of the trachea? Arc of the aorta.
Aorta.
Which branch from the arc of the aorta as the first are visible anterior to the trachea?
Left brachiocephalic.
Brachiocephalic trunk and left common carotid. Are you able to find the left subclavian anterior to trachea?
No.
No. So in your exam, it is possible I ask you, all of the following structure are going to be found anterior to the trachea except. What about the arc of the aorta? Yes. What about the brachiocephalic trunk? Yes.
Yes.
What about the left common carotid?
Yes.
Yes.
What about the left subclavian?
No.
It is going to be found in left side of the trachea, not anterior wall of the trachea. Now, if you notice here, you can find anterior to the trachea. Also, I am able to show you east of the thyroid gland. You know, here is the thyroid gland, and here is the thyroid cartilage. This thyroid cartilage belongs to the larynx. It is the largest cartilage inside of the larynx. Inferior to thyroid cartilage, I am able in this picture to show you the thyroid gland. Okay? Thyroid gland is different from the thyroid cartilage. Now, the isthmus, this segment that connects the left lobe to the right lobe of the thyroid gland, we call the isthmus. This is going to be found anterior to the trachea. If you notice to this picture, what's the name of this vein? Left
Cephalic vein.
brachiocephalic. The left brachiocephalic is passing in a small
Cephalic.
portion anterior to the trachea. And here, if you notice, you can find another structure anterior to the trachea. This picture is going to show you the hilum of the right line and the hilum of the left line. This sleeve-like of the cleft is visible here. This sleeve-like of the cleft is going to cover all of the content of the hilum. Which structure are visible in each hilum?
Superior
Anterior
and
is,
superior
what is
pulmonary,
this?
superior pulmonary artery.
Pulmonary vein. Pulmonary vein are visible here. Why here we use from the red color for
Because the blood is
pulmonary vein?
oxygenated.
Because the oxygenated blood are passing on through the pulmonary vein. So only in the hilum of the lung, the vein are going to show to you by the red color. Okay? But
Yes.
in the another part of the body, in the hand, in the abdomen, in the lower limb, we are going to show you all of the artery by the red
Right.
color. Here, because inside of the pulmonary vein, you are able to find the blood with the oxygen, and this blood are going toward to the left atrium, so we use from the red color. Posterior to the pulmonary vein, I am able to show you pulmonary
Arteries.
artery. If you remember, from the right ventricle, the pulmonary trunk ascend and inferior to arc of the aorta divide to the left and right pulmonary artery. Always, in most part of the body, the vein are visible anterior to the artery. So here, the anterior structure that in this picture we are going to show you by the red color are going to remember you the pulmonary vein. Exactly, posterior pulmonary vein, I am able to show you pulmonary artery. And posterior to pulmonary artery, you are able to find the main bronchus. Right and the left main bronchus. Do we get that?
Yes.
Yes? The trachea is visible anterior to this structure. What's the name of this structure?
Esophagus.
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 So, esophagus is anterior to the vertebral column. Anterior to the esophagus, you are able to find and to look at to the trachea. Trachea is passing through the neck, through the superior mediastinum, and exactly inferior, so arc of the aorta divide to the right and left main bronchus. Okay?
Yes.
Now here, you are going to look at to the trachea. Trachea is going to be begin inferior to the larynx. Larynx is going to be formed by some cartilage, by some membrane, by some ligament, by some muscle. Inferior to the larynx, I am able to show you the trachea. The trachea, if you notice, you can find some cartilage. The cartilage that they are going to participate to form the trachea, these cartilage are not O-shaped. They are not circle. They are C-form. Okay? The cartilage that participate to form the trachea are C-form. But you know that the trachea is going to form such as a circle posteriorly. Here, you are not able to find the cartilage. Here, you can find a connective tissue with a smooth muscle. You can find a fibrous layer with a smooth muscle. Okay? A membrane. A membrane is going to complete posterior part of the C or U form of the cartilage in the trachea. So anteriorly and lateral side, in left and right side, we have cartilage, but posteriorly here, I'm not able to show you the cartilage. Here you can find a fibrous layer, a fibrous membrane with a small amount of the smooth muscle. Now, in this picture, you are going to look at to the trachea and around the trachea. So anteriorly and laterally, you are able to find the cartilage, but posteriorly, you are not able to find the cartilage. This posteriorly, you are not able to find the cartilage. Now look at here. Each main bronchus is going to enter to the hilum of the left and the right lung. These U-shape, U-form or C-form of the cartilage are visible superiorly, exactly here at the inferior end of the trachea, this part. You can find a cartilage that has a spatial name. This cartilage you can call carina trachea. This cartilage we can call carina trachea. It is the last cartilage in the trachea. Why we call the carina trachea? Because it is going to find at the beginning of each of the bronchus, right bronchus and the left bronchus. We call the carina trachea. You should know, if a small particle come inside of the respiratory system, go inside of the trachea before passing through the carina trachea here, the coughing is going to help to you to throw out, to take out this particle. After passing the particle through the carina, the coughing stops. Okay? So this is important. When an extra particle, the air not have any particle, the air, all of the structure are going to filter. They are going to help to your breathing that a healthy air go inside of the lung. If any extra particle with the air coming inside of the trachea, the coughing is coming to help to you. Okay? To throw away this extra particle. Here you have a very high coughing. After passing from the carina trachea, the coughing stops. Now, if you notice here, each bronchus, right and left bronchus are visible here. Which of the bronchus is longer? Left bronchus.
Left.
The left bronchus is longer and narrower. the right bronchus is shorter and wider. The right bronchus is in continue to the trachea, but the left bronchus make the angle with the trachea. Means if I want to show you the trachea here, it is better. I told you that in the left line there. Here, okay, it is wider and shorter, it is longer and narrower. If a particle comes here, what do you think? In most of the time, this particle is going into the right bronchus or left bronchus?
Right.
Because the left bronchus is narrow and make the angle, it is obliquely direction, but here it is vertical direction, such as the trachea. So a particle if come here, most of the time is going to be found inside of the right bronchus. Do you get that?
Yes.
Each bronchus is going to enter and passing through the hilum to enter to the line. Each bronchus is going to enter to the line and divide. Divide to become very small. The main and small part of the line that we call alveole. Now here, each bronchus is going to divide and become smaller and narrower. Okay? At the end, it is going to make the alveole. In the trachea, in the big bronchus, in the large division, you are able to find the cartilage. Look at the cartilage. When they are coming very small, the cartilage is going to disappear. What's the function of this cartilage? What do you think?
Attachment of alveoli.
No.
Without cartilage, they become as
Yes, you know the muscle is able to contract, okay? So when the cartilage is going to decrease in amount, the muscle, the smooth muscle are going to increase. The muscle, we know that they are able to contract, but the cartilage are not able to contract. So in all of the item, all of the subdivision that you can find the cartilage means the lumen always is open. When the cartilage disappears and the muscle is coming to form the wall of the structure means the muscle are able to contract. So making problems such as the asthma. Have you ever heard?
Yes.
So when they are going to become very small and very small, look here, this blue color that are going to show you the cartilage, they are going to disappear. And so in the small segment, a small division of this tree, you are not able to find the cartilage, and the smooth muscle are going to participate to form the structure, and we know the smooth muscle are able to contract. Here you are at exam. In cardiovascular system, I explained for you. If I ask you which of the following items is visible anterior to the trachea, I told you the deep
Venous.
cardiac plexus is visible here. So another item that it is possible you find anterior to trachea is the deep cardiac plexus. Do you remember?
Yes.
Now, in this picture, it's a radiography. You are going to look at to the thorax. You know, these space belong to the left and to the right line. Why they are black in this picture? Because
Because
the
they don't
X-ray
have
are
the
passive. They are not going to absorb. Now, above the bone, yes, the X-ray are going to absorb, so they are going to show the white color. In this picture, here, this black longitudinal line is going to remember you the trachea. This black tube is going to remember you the trachea.
Trachea.
Are you able to see what
Yes.
are? Yes. Now, in this picture, you are going to look at to the below of the left line, below of the right line. Here is the diaphragmatic surface of the line, and the apex will be here. And if you notice, this red color are going to remember you to show you the cast of the throat.
Throat,
Okay?
Are those white, like, like webs inside, are they the alveoli and the small brachii?
This, which item?
They look like webs, small white lines inside the lung area.
Which part? Come and show to us. Here, it is going to show you the hilum, all of the structure in the hilum. Now, it is possible, for example, we are waiting to look at to the right line and left line. It is possible, for example, a nodule, a kyst, a tumor find here. The tissue of the tumor is going to absorb the X-ray. So it is going to show you a dense white color here. So it is going to show you it is pathology. But this picture is going to remember you the normal picture. It is the hilum of the right line, hilum of the left line. Now, here you should know the apex, the cupula of each line is visible here. What's the name of this bone?
Clavicle.
Clavicle. The clavicle anteriorly is going to make joint with the sternum, and we call the sternoclavicular joint. Which kind of? Synovial, saddle. Now, if you imagine, here is the clavicle, superior to the clavicle here, in the root of the neck, we are able to show you the apex of the line. The apex of the line is here. You know the first rib posteriorly, the position is superior to the anterior end, yes? Here, just here. So, the apex of the line anteriorly is not going to support by the bone, but posteriorly, the apex of the line is going to support by the bone. Means, if a knife, if a sharp structure, sharp instrument, go here anteriorly to the root, to the base of the neck, it is possible make problem for the apex of your line. This apex anteriorly is not going to be covered by the and protected by the bone, but posteriorly, yes, the first rib is going to protect the posterior surface of the apex. This picture is going to remember you the left line, right line. What is the difference between left and right line? Which of them is larger?
Right line is 2 parts.
Right line is larger.
No.
Is heavier. The right and left line. This white color is going to remember you the plea. Which kind of the plea here is parietal pleura? Where is the visceral pleura?
Is it
Outer layer of the line. Okay? The anterior border of the right line, anterior border of the left line. Anterior border of the left line is visible here, it is straight. But inside of the anterior border of left line, you are able to find a notch. The name of this notch is cardiac notch. Means anterior border of the right line is straight. But if I want to show you the anterior line of the left line inferior to the hilum, I am able to show you a notch. What's the name of this notch? Cardiac notch. So cardiac notch is visible in which border of the line? Anterior border, in right side or in left side?
Left.
In the left side. Now look at to the pleth. The pleve here for the right line is straight, but in the left line, in the pleve also you can find a notch. Means the pleve anteriorly is going to accompany this cardiac notch. Do you remember this space of the part we call the Bail area or cardiac dullness? I told you, if in pathological time, around the heart, inside of the pericard, in pathological time, the liquid coming, such as the blood, such as the pus, accumulate without doing any strong surgery. You can pass a needle in the left side of the sternum, access to the pericardial cavity, and remove this extra pathological flow. This space we call the Bail area of the pericard or of the heart. It is visible exactly immediately posterior to the sternum. This cardiac notch help to you to make larger this Bail area. Now look at the picture. In which view you are going to look at to the posterior. Please notice to the apex of the line. Here I am able to show you the first rib. The first rib posteriorly in both sides are going to protect the apex of the line, but anteriorly this first rib is not able to protect. So anterior of the apex is not going to support by the bone. Now here it is going to remember you that between the first rib and the transverse process of the C7 in each side, you are able to find the suprapleural membrane. The suprapleural membrane. It's possible in your exam. I ask you the suprapleural membrane inferiorly attached to which of the items? Please remember medial border of the first rib. The apex is going to attach to the transverse process of which vertebra? The last cervical vertebra. What's the function of this suprapleural membrane? The function of this suprapleural membrane, it is going to support the apex of the pleura. Okay? We get that?
Yes.
Now, it is going to explain for you that the pleve is a such larger than each line. The pleve is larger than the line. Means around the right and left part, you are able to find the pleve. The pleve that is going to appearance to the line we call visceral pleura, okay? We call visceral pleura. This visceral pleura around the hilum reflect to be able to make the parietal pleura, okay? Parietal pleura. This space between the visceral, and parietal make a large space. One of them is here. We call recess. This recess is between the covering sheet of the parietal pleura that cover the costal surface, and here reflected to cover the diaphragmatic surface. Here make a recess we call costo-diaphragmatic recess. Costo-diaphragmatic recess. In this picture, you are going to look at the costo-diaphragmatic space. This we call the costo-diaphragmatic recess. Inside of this recess, according to the gravity, if any fluid accumulate inside of the pleural cavity according to the gravity is coming and accumulate here. So you should remove this extra fluid inside of the pleural cavity because this extra fluid is going to make problem for the patient. In some of the movie, if you notice, you can find that the doctor is going to explain for the patient that you are not able to breathe normally because inside of the pleural cavity of your pleural cavity, accumulation of the fluid is going to compress your lung. I'm going to remove this extra fluid to help you to breathe normally. Okay? Now, in spatial intercostal space, the surgeon, the doctor, is passing a needle to be able, to access inside of the posterior diaphragmatic space or recess and remove this extra fluid. Okay? You get that?
Yes.
Now here, it is going to remember you in surface anatomy. Let's notice to the picture. This green line in the right side is going to remember you the anterior reflection of the parietal plane, anterior border of the right line. It is straight. But anterior border of the left line, here we have a notch. What's the name of this notch?
Cardiac notch.
Now I notice to this picture, again the cardiac notch is visible here in the left side. And if you notice to this picture, you can find that anteriorly, posteriorly, and laterally, we are able to show you this blue space. This blue space is going to remember you that the pleural sac is larger than the lung. During the expression, when the lungs are going to dilated and again a small inside of this space is going to happen. Now, in this view, you are going to look at the anterior surface of the cupula, anterior surface of apex of the line. Are you able to find any bone here?
No.
No. I told you the apex of the line anteriorly never has any protection by the bone, but posteriorly, yes. The posterior end
First
of the
rib.
first rib is going to protect. In this picture, with the pans, we remove the left line and right line. In the medial sinar surface of the right, at the medial surface of the left line, I am able to show you this nerve. What's the name
Vagus.
of this nerve?
Vagus nerve.
Phrenic nerve. Phrenic nerve is coming down anterior to the hilum. So phrenic nerve is coming down anterior to the hilum. This phrenic nerve is coming to innervate the diaphragm, has some branch for the pericardium, and also has some branch for the medial sinar surface of the pleura. What about the lateral or costal surface? This costal surface of the parietal pleura is going to innervate by the intercostal nerve. What about the diaphragmatic surface? The intercostal nerve and the phrenic nerve, both of them are going to innervate the parietal pleura in the diaphragmatic surface of the plane. I repeat, if you are in the exam, I ask you which surface of the plane is going to innervate by the phrenic nerve. Which surface? Only medial and the diaphragm. Which surface of the parietal pleura is going to be innervated by the intercostal nerve.
The lateral.
Lateral or costal surface. Only costal surface.
No, and
Also
also.
diaphragm. So diaphragmatic surface of the parietal pleura is going to be innervated by the phrenic and the intercostal nerves. Now, what about the visceral pleura? What do you think? Such as the visceral pericard. The visceral serous pericard is going to be innervated by sympathetic and parasympathetic. The visceral pleura attach adherence to the lung. So again, they are going to be innervated by the sympathetic and parasympathetic. Okay, 10 minutes break.
And